Yes, I work at Meritage Medical Network. You're due for your annual wellness visit. It's a free, no-cost exam where the nurse practitioner comes to your house to perform a wellness exam. It's focused specifically on preventative health care.
I think there's a definite advantage to having a patient in their own environment. There are things that can be perceived by the practitioner, whether it be a nurse practitioner or otherwise. One, it's a different perspective for the patient and for me. But two, it does provide all the information that I will need to ensure that my patients are getting all the things that they should be getting at their age.
The number one thing is that we actually get an updated medication list for the patient. Secondary, we also update all of their problems, their whole problem list. So now what's going to be left is going to be the most updated one that the patient actually is being treated for. By me coming out into the home, I've identified other problems such as mobility issues.
There's a lot you can determine about the way they live, the way they're organized, how clean the area might be, whether they have distractions like things that might be safety issues for them.
It gives me a chance when I'm there to really assess their state of mind. After a little while, when they're more relaxed and we have been talking, then it's easier for me to ask questions and help them to open up.
Nurse practitioners can be of extreme value, especially in a time now where there's a primary care shortage.
We're going to review the current conditions and also all of your chronic conditions.
We're always, as physicians, pressed for time.
Your lipid profile, that's talking about your cholesterol levels.
We start discussing very, very generally with the patient, and we start reviewing their conditions and then the medications, and then we go more and more into depth.
And I will also go through a list of all of your doctors that you're seeing so we can update that.
And many times people would ask me, well, if I take this medicine at night, can I also take this other medicine at the same time?
A lot of supplements can actually react with medications that you're taking as well.
Right. When we're sitting at a more relaxed atmosphere, just the patient and I, we can discuss these things, and I can take up each medication and we can discuss that. Are you taking this as it's directed here every morning and night?
I have 2 boys, and then I have 7 grandkids.
Oh my gosh. So when they come in for the annual wellness, it's a time that I can dedicate to just honing in on some of the maintenance items that I want to address that every patient of that age should have. And breathe out.
It's like a little light goes off inside them, like, oh, this is really good, and you are just going to listen to me? And I said, yes, I'm going to listen to you for the whole hour, and we can talk about all of these things that you might have been wanting to ask, and I'm all ears, only for you.
And it's an opportunity to talk to them about issues that perhaps are not brought up during regular visits. One would be the advanced care planning. That's something that I really dedicate a portion of my annual wellness evaluation to. The traditional visit by a physician was usually at home, and I think there was value there that's been lost in the way we practice medicine now.
It makes me feel good when I go in there first and we are very hesitant and sort of dancing around it, and when I leave there with a hug and sometimes a tour of the house or the garden or both. And that makes me feel that I came in just as a clinician and I'm walking out of there as a friend.
It's helped me a lot to know I have the support.
I'm glad you came out to do and give me some good news, because that's what I needed.
Absolutely.
They're somewhat different than the traditional visit and evaluation, and so there's still some getting used to on the side of both the practitioner and the patient. But I think ultimately it does serve value.